Oh boy. Okay. I was not,
Recording now.
unfortunately, I was not recording. Okay. Uh, just for the purpose of recording, I'll just read through it. I'm not going to go through the details. I did these first slides. So we're talking about the tissues, and the tissues are a group of cells, um, similar cells that have common function. Studying the tissues is called histology. Histo means tissue, ology means function. So this is histology, and we have four different types of tissues: epithelial, connective, muscle, and nervous system. I went through this before I start recording, so you guys can, if you're seeing the recording, you will need to go through this as an introduction, but we will see the details anyway. Then I'm talking about the junctions in between each two successive cells. And we have tight junctions, desmosomes, and gap junctions. Tight junctions, from the name, the junction is too tight. The extent of the cells are merging and fusing together. And the example of that is the blood-brain barrier. And yes, you need to know what does it mean and where. So this is merging and fusing. And where is that? Blood-brain barrier. This is on purpose because you don't want to leave a gap in between the cells. Things can go in and out, reaching to the brain. It can be harmful. The next one is called the desmosomes. The desmosomes, which is this picture right here, there is a gap in between the cells, but the cells are connected by spot welding, something that's welding these adjacent cells together. And the example of that is the outer skin. It has this type. The gap junction is the third one. There are tubular channels in between each two successive cells. If you look at this, this is a tubule that have a channel, meaning it have like a tunnel, like an opening inside. And these channels are called connexons. And as I mentioned, the connexons probably is not in your slides, but again, I mentioned the slides will cover like 90% of the material, not 100%. So if you see me adding something, you need to know it, even if it's not in the slides. And again, it's not going to cover you 100%. But somebody was asking me about the slides before. I said it's going to cover you 90%. You can do very good with the slides, but so I was advising you do the slides and master the slides first, and then you can read a little bit more from your textbook. If you're aiming like for A plus or something, you might be able to get an A with the slides, but again, it's not 100%. I'm trying to add as we go to make it's not 100% anyway, but I'm trying to contain as much as possible of the related material. So connections is one of the things that you need to know, which is these tubular structures. And these tubular structures are for the molecules to move in between cells. Like if there are molecules in this cell, inside, I'm not talking about the gap in between, inside. So here is one cell and here is the other cell. So molecules can go within these tubular channels called connexons, and they can move from one to one. And the example of that is the cardiac cells. And again, this is for a reason. The reason is things can move in and out, so you can reach out to the different cardiac muscles very fast. So this is a comparison that I already mentioned. So it's always summarizing, so take a look at it. From science to technology, this is something usually it's additional. So do not expect, I mentioned that a couple of times before, do not expect much questions from something like science to technology or like clinical applications. This is just to help us understand, but it's not a real question. And this is basically talking about something like the blood-brain barrier, or how they use a nanotechnology in order to help tiny things to be delivered, like they use it in different types of medications. Blood-brain barrier is very tight. It's tight junction. So things cannot reach to the brain easily. It's extremely hard for molecules, even if it's small. It's very hard to reach to the brain, and this is obviously for protection of the brain. So if that's the case, they can use this technology to help medications, for example, or anesthesia, or chemotherapeutic agents that we wanted to reach the brain. You can mix it with something that's very tiny that help you cross the blood-brain barrier. It's just clinical application. So epithelial cells, epithelial tissues, I mean, these are the first ones that we're talking about. And what I put underline here is very important. So what are the epithelial cells? I mentioned it. It cover and line different body surfaces. Cover and line. Cover from outside like the skin, line hollow organs, something like the digestive system, the respiratory system, the reproductive system, the urinary system, anything that have hollow organs. And it can also make glands. So this is obviously very important. I mentioned also that it's avascular. And I talked about this before, and you see it over and over again. If you see A-N, U-N, I-N, U-M, any one of those at the beginning of any word, it means no or without. So A, vascular means vessels, meaning no vessels, no blood vessels. It means there are no blood vessels. So you can ask yourself, if there are no blood vessels, how can you send oxygen and nutrients to these cells? It's cells anyway, and cells need to eat, need to get nutrients and oxygen, otherwise it's going to die. How it doesn't have blood vessels and it can still get the oxygen and nutrients? It take it from the underneath tissues. Like the next tissues are connective tissues, they have blood vessels, and so the oxygen, when it is in the underlying structure, it can squeeze itself and move up and diffuse and go to feed the epithelial cells, even without the presence of vessels. Same thing for the nutrients. And we're going to talk about the epithelial cells according to two things. Number one is the cell shape, how the cell that's making these tissues. We said that the tissues are group of cells that are similar and have a common function. Similar, have a common function. So depending on how these cells that are making the tissues looks like, this is one. The other thing is how many layers. Is it just one layer of cells? You still call it a tissue, but what kind of tissue? What if it is different layers? So from the shape, it can be squamous, and which look flat, and I will show you the picture. And squamous, to remember it, squeezing. Just to remember, squamous, squeezing. When you squeeze something, it will become flat. So it looks like this, like my hand, flat. Cuboidal, from the name cuboid. Cube means cube. Oid means similar to. Cuboidal, it looks like a cube. Columnar, it looks like a column. So it's tall. This is one. The other thing is, so now it can be squamous, it can be cuboidal, it can be columnar. The next thing is, whatever the one that you're talking about, squamous. So the cells are squamous. Is it squamous cells beside each other in one layer or multiple layers? If it is one layer, you call it simple. If it is multiple layer, you call it, which is two or more, you call it stratified. So we have simple, stratified. So I ask you, what type of tissues is this? What kind of epithelial tissues, I mean? You say, okay, let me see. The shape is squamous. This is the first part of the name, or the second part of the name. Then you ask yourself, am I having one layer or multiple? One, so it's simple. In this case, you say simple squamous. What if you have one layer only of cuboidal cells? Simple cuboidal. How about columnar? Simple columnar. Scenario number two, what if I have multiple layers? Look at the top one and see what kind of cells. But if it is multiple, you call it stratified. Stratified what? Stratified squamous, stratified cuboidal, stratified columnar. Let me tell you this. The vast majority of time, almost most of the time, the multiple layers are not the same type of cells. So if I see it multiple layers, should I call it stratified? Of course, yes. But stratified what? Squamous, cuboidal, columnar. It's always a mix. Look at the outermost only. If the outermost is squamous, you call it squamous stratified. But there are cuboidal cells underneath. That's fine. Still squamous. This is what they agreed to call it. So we have to take it as it is. So that will give us simple squamous, simple cuboidal, simple columnar, and then stratified squamous, stratified cuboidal, stratified columnar. So let me ask you this. If I'm saying stratified cuboidal, what does it mean? Does it mean that all the cells are cuboidal, all the layers? But you,
No.
no, what does it mean then? Stratified cuboidal, what does that mean? It means the top layer is cuboidal. How about stratified squamous? The top layer, it's multiple layer, and the top layer is squamous. So you call, if it is multiple layer, you call it stratified automatically. Stratified what? Look at the top, and look at this example right here. This is simple squamous. It's one layer only, which is the orange. I'm not talking about the underneath. The underneath is not even epithelial cells. The epithelial cells is this squeezed flat cells. What should I call it? Simple squamous. So in any one of those, what I want you to know is, what does it mean? This is number one. Number two, where? Like examples. So what does it mean? Simple means one layer. Squamous means squamous cells, which is flat. Number two, where is it? It can be in the capillaries, it can be in the air sacs lining the blood and lymphatic vessels. So it's alveoli, capillaries, lymphatic vessels. Next one is simple cuboidal. What does it mean? Simple means one layer. Cuboidal means it's cubical shaped cells. So look at these cells, how it looks like a cube. Where is it? In glands, the ducts of the glands. It's also located in other parts. This is very important, but it's also in cover the ovaries and located in the kidney and thyroid follicles. Next is simple columnar. What does it mean? Simple means single layer. Shape is columnar, which is elongated. And location is uterus, stomach, and intestine. These cells are cells that are going to help with the absorption and secretion. So this is another thing that's important. What's the importance of simple columnar? Secretion and absorption. What does it mean? It means one layer of columnar. Where is it? Uterus, stomach, intestine. This is where it is located. There is an additional thing that these columnar cells specifically, unlike the other cells, they have extensions on the surface. This extension can be very tiny. We call it cilia. And it can be very tiny and that looks smaller. We call it the microvilli. I mean the microvilli, and then the smallest is the cilia. So these on the surface here, it can be microvilli or it can be cilia. If you ask yourself, why do we have something on the surface like this? It is there intentionally to move things around so the columnar cells can absorb. Like if there is something on the top of these cells, the cells will absorb as much as possible. But if you use these hair-like cells, it will push it in more, it will make more friction so it can help the function. So now we did the three simple cells: simple squamous, simple cuboidal, simple columnar. There is one that's called pseudostratified columnar. Does anybody know what pseudo means? What does this prefix mean?
False.
Exactly, it means false. So pseudostratified means false stratified. What do you mean by false stratified? It is not stratified. It looks like stratified. It looks like. It gives you a false impression that this is stratified. So they cannot call it simple columnar, even though it's one layer, because it looks unusual. They put it in a separate category, and they call it pseudo stratified. Is it simple? It is kind of simple, but it looks like multiple layers. Look at this picture right here, and you will understand what I'm talking about. If you look at this one cell right here, it's one cell only from the beginning, from the start to the end. Next, from the start to the end. So this is only one cell layer, but if you look at it, it will give you that impression that's multiple layers. And that's because if you have all these columns beside each other and you push them, squeeze them, some of them will bulge up and some of them will bulge down. So it will give you that false impression or false view that it is stratified. So we call it pseudo-stratified. And this is, most importantly, is in the respiratory passageways. Now the three stratified, same thing as we mentioned, simple squamous, simple cuboidal, simple columnar. This is stratified squamous, stratified cuboidal, and stratified columnar. What does stratified means? Two or more. It doesn't, most of the time it's a lot, but scientifically, anatomically, if it is two or more, we call it stratified. So stratified squamous epithelium, the example of that is the outermost, the name first come from, remember the rule, if you want to call a stratified epithelial tissues, the name goes with the top layer. Look at this picture right here. You see the top layer right here is squamous epithelium. If you look underneath, this is not squamous. This looks like cuboidal, and you might see some columnar. So you have multiple types of cells. What should I call it now? It's stratified because, as you see here, it's a lot of layers. So it is stratified anyway. What type of stratified? You see squamous, you see columnar, you see cuboidal. What should I call it? You call it by the top layer only. If you look at this, the top layer is squamous. I call it squamous. Why don't you call it another name? This is anatomy, and this is what they decided to call it. They agreed to call it by the top layer. The top layer here is squamous, so this is stratified squamous. The best example for the stratified squamous epithelium is skin. Your skin is stratified. You have to know what does it mean and where is it located, okay? So the example here is skin. Your skin is stratified squamous epithelium. But there is something specific here that you need to know about the skin, and we will talk about it more when we talk about the skin, is it is also not only squamous epithelium, but it's also keratinized. What keratinized means? The cells are filled, a lot of cells here are filled or contain a lot of keratin. Keratin is type of tough protein. This is done in purpose to make these cells tough so they can protect you. It's also available in other types of tissue, of epithelial tissue that are connected to the outside, like oral cavity. Oral cavity is a cavity that's open to the outside. The vagina is a cavity that's open to the outside. The anus or the anal canal is a cavity that's opening to the outside. So anything that's why, the reason why, because anything that's communicating with the outside or open to the outside, there will be a friction anyway. Things are going in and out, whatever it is, depending on the nature. So you needed to be strong enough to face this multiple friction that's happening on a daily basis. And that's a rationale of having stratified squamous epithelium, which is tough type of epithelium. Because of the nature, the tough nature of the stratified squamous, you put it in these types of cavities that have communication and have a lot of friction in and out. The next step is called stratified cuboidal. This is multiple layers of cuboidal cells, and you need to know the location of this. It is in the ducts of the mammary, sweat, and salivary glands, and also in the pancreas. Location is always important. Stratified columnar epithelium, I think the name gave it away. Do you think all the layers are columnar, if you're following with me? This is stratified columnar. Does it mean that all layers are columnar? What do you think?
No.
No, it means the top layer of columnar. How about the other cells? Not my issue. It's not my issue. Whatever it is, just tell me the top layer only. The top layer is columnar, that's it, enough. And I'm talking only about the orange. Under the orange is connective tissue. It's not epithelial, so it's not my issue now. They put it because under epithelial cells, you always have connective tissue that we will talk about. Where is the location of stratified squamous epithelium? It is lining the male urethra, the duct of the exocrine glands. What do you mean by exocrine gland? It's coming. The glands that have secretions. We will come to that. Here is a unique type that's called transitional epithelium. Transitional epithelium, again, it's all about understanding. Understand, don't just memorize. What do you mean by transitional epithelium? It is just a regular epithelium, but they put it uniquely. Like, remember the stratified columnar epithelium? They put it in a separate category because it's unique. It have a unique thing. This also have a unique thing. So what type of cells is it? It's transitional. What do you mean by transitional? Is it like squamous? Is it cuboidal? No, it's transitional. How about the top layer? Also transitional. So here's what it means. If you can you guys see me, or you only see the slides?
Only see the slides.
You only see the slides. You can't
I see both.
I see both.
I see both.
I see both.
It should be on the side, I think. So here is how it goes. If it looks like this, it can be like cuboidal cells like this. This is cuboidal. But when you, if this is the gallbladder, for example, which is the most important location, if the bladder is extending and accommodating and filling with urine, it's going to transition from cuboidal to squamous. So it is transitional. So you cannot call it actually squamous because it's not squamous all the time. You cannot call it cuboidal. You cannot call it columnar because it's change. It's transition from shape to shape. And this is where the name came from. Transitional location here is urinary bladder, ureter, and urethra, which is basically urinary bladder and what's related to the bladder. The next epithelium is inner glands. And the glandular epithelium is these types of epithelium that have secretions. These are specified in secreting things. And there are two different types of glands that these epithelial cells make. The two types are endocrine and exocrine, and use the rule again. I told you last time that you will see endo and exo all the time. You guys still remember endocytosis and exocytosis? This is how it goes. Endo means inside, into. Exo means outside. Crine, the second part of the name, means secretion. So endocrine glands means the gland that secretes endo, inside, not outside, not exo. And this is simply the glands that does not have a duct. It does not have a duct. So if this is a gland, if you can see my hand, if this is a gland, and you or glandular epithelium here, which is cuboidal, and it's making secretions, there is, if you have a duct like this, the duct will take it out all the way. So we call it exocrine. You have a duct that will take the secretion out, we call it exo. If you don't have a duct, the secretion will go endo, into, in between the cells. And if it go in between the cells, it will move in between the cells until it go to the blood. So this is the difference between endocrine and exocrine. These are the two different types of glands that you need to know. The exocrine cells can be unicellular, like one cell, one cell, one cell, one cell, like this, like one sheet of cells, or it can be multicellular. And unicellular is something like the goblet cells. Goblet cells are cells, one cell layer within the intestine and respiratory system that secrete mucus. Multicellular, which is a group of cells, something like sweat glands and salivary glands. Beside that, the exocrine glands, and again, exocrine glands are glands that have a duct. Look at this picture here. This is the gland itself. You see a duct right here, right? See this duct? So these cells, epithelial cells, cuboidal cells, are going to make secretion. The secretion will go to the cavity, and the duct will take it out to the tissue surface. So since you can take it out, out is exocrine, secretion out, because you have a duct. If on the other hand, if this cells, if let's say I have only this part right here, just this part, and there is no duct, this is called endocrine gland. And depending on the shape, it can be simple or it can be compound. Simple, just something simple like this. Compound means it looks more like branching like this. And it can be tubular or alveolar. This looks like a tube, and this looks like an alveolar shape. Alveolar is like a sac, like this. Tubular is like this, tube. This is alveolar, and this is tube. So it can be tubular, it can be alveolar. It can be simple, like those top four, and it can be compound, like these at the bottom. These are the different shapes. This is summarizing everything you can review from this slide. And the other thing about the glands is, let me say it this way. Beside the fact that the glands can be endocrine and exocrine, the exocrine glands itself, depending on what kind of secretion, and more importantly, about what kind of change happened to the gland when they secrete. We will have different types of glands that you need to know. These glands can be merocrine, apocrine, holocrine. So we have mero, apo, and holo. What does it mean? Mero means exocytosis, or you're secreting without losing anything. Apo means top, meaning when you secrete, you lose the top part of the cell, apo. Holo means whole, the whole thing, meaning when you secrete, the whole cell is gone. You secrete and die. This is where the name came from. And the example is very important here. Merocrine, which only secretes, but no major change happened to it because it's secreted by exocytosis only. So it's not losing anything. Like it make a vesicle, and the vesicle take it out. If you studied already what we did last time. So exocytosis, it makes exocytosis release and then rebuild. You're not losing anything. Like sweat glands and salivary glands and the pancreas. Apocrine gland, on the other hand, these glands, they lose the top parts only. Apo means top. So apocrine glands mean the glands that secrete and lose the top. And the example of that is the mammary gland and ceruminous glands. Ceruminous glands are the glands that secrete cerumen inside your ears. Cerumen is the earwax. So what happened to these glands? The cells make the cerumen or make the earwax and lose the top part of it every time it makes the secretion. I'm sorry, I mean, yes, it lose the top part. Holocrine gland, on the other hand, is the one that make the sebum. And this sebum is that make the fat of your hair. If there is some oily secretion that goes to your hair to make your hair looks smooth and moist and so on. So these sebaceous glands, every single time they secrete, the whole gland is gone. And this is where the name came from. So here is a comparison. Again, these comparisons will help you to put things together. So I'm not going to repeat everything over again. The next type of tissues is connective tissue. And I mentioned that connective tissue, generally speaking, connective means to connect. So this is obviously in between cells. This is the main parts, but this is not the only thing. This is the most abundant one. So if I ask you what's the most abundant type of cells that we have, tissues, it's the connective tissue in between the cells. So if this is one cell and this is one cell, what's connecting them, what's in between the cells is always connective tissue. The functions here are very important to remember. What are the functions of the connective tissue? Number one, to connect, which is bind. Support and protection, like the bone is connective tissue. The cartilage is connective tissue. The fat is connective tissue. The blood is connective tissue. So it's filling the space, it's storing fat. Blood is connective tissue. Let me give you a rule here, the rule of the thumb. How to know which tissues are connective tissue? Should I memorize every single one of those? No. Here is how to tell if this is connective tissue or not. Ask yourself, is this an epithelial tissue? Is it covering or lining? If the answer is no, it's not epithelial tissues. Is it muscle? Meaning, does it contract? No, It's not muscular tissue. Is it part of the nervous system, connecting electricity? If the answer is no, by exclusion, anything is connective tissue. Let me give you example and apply the rule. It will always work. Liver, is that a connective tissue? Is it epithelial tissue? Is it like covering the body from outside or lining the cavities? Obviously not. Do you think the liver contracts? Does your liver contract like muscles? It's not a muscle. Is it part of the nervous system? No, it's connective tissue. How about your blood? Is your blood epithelial tissue? Like, is it covering from outside, like your skin? Is it covering or lining from inside, like your cavities inside? Of course not. It's a filling. Is it muscle? Does your blood contract? Of course not. Is it a nervous system? No, it's connective tissue. You name it. There are a lot of connective tissue, and you always get it by exclusion because simply it's anything else. Is it epithelial? Is it muscular? Is it nervous? If your answer is no, automatically call it connective tissue. How about the fats? How about the blood? How about the bone? How about the cartilage? How about the lymph? Anything. The fluid in between the tissues, the fluid that's filling anything. You name it. You name it. Just ask yourself this simple question. Is it epithelial lining or covering? No. Is it a muscle? Is it nervous system? No. Connective tissue. It helps us with repairing the damage. It acts as a framework, like fibrous tissue inside, and so on. But you need to know the different functions of the connective tissue. The matrix. When we talk about the connective tissue, as I mentioned before, connective tissue, any tissue is a group of cells that are similar and doing a common function. These are similar cells that are making common function. But here, the unique thing about the connective tissue, it's not only cells. There is also a matrix. Cells and matrix. This is what's making the connective tissue. So the cells, there are different types of cells that I will go through it fast, but there is also the matrix, and this matrix is going to contain types of fibers. Let me say it one more time. Connective tissue, how to know the connective tissue? I told you the rule. Number 2, what's a connective tissue? It's a group of cells. Only cells? No, there is cells and matrix. This is unique. Cells and matrix. What's the matrix? The matrix is fluid and fibers. Okay? Fluid and fibers. So you have cells and matrix. What's the matrix? Fluid and fibers. What fluid and what fiber? We will talk about it. Clinical application as usual. Don't worry much about it. Just you can apply your knowledge. It's basically talking about what if something wrong happened to the connective tissue, like cancer of the connective tissue, the fibroblast, which is one type of the connective tissue cells that can be like broken down and it can die, and surrounding different organs, so the cancer can spread. It can replace, like if you ask yourself, if somebody's having heart attack, meaning the heart muscles are going to die, do we replace it with other muscles? No, unfortunately, muscles and nervous system are not replaceable. You cannot replace it. So are you going to leave this heart that the muscular tissues died? Are you going to leave it like to open like this? No, you replace it with fibrous tissue, which is fibrous tissue or connective tissue. So this is how it goes. Now the cells, what kind of cells do we have in the connective tissue? I have the fibroblasts, and these are the ones that secrete the matrix, I also have the macrophages, which is called the histiocytes, and macro means big, phage means eaters. We talked about this. So this is eat anything that's not needed, specifically invading organs. Next one is called the mast cells. And the mast cells are two things that you need to know about it. Number 1, it secretes the 2 H's, heparin and histamine. Heparin and histamine. Why? Because it's involved in inflammatory reaction. So when you hear mast cell, what should come to your mind? Inflammation, inflammation. Mast cells, inflammation. If you have any inflammation, mast cells secrete heparin and histamine in order to help you to make that inflammation and all of us got inflammation in a way or the other, which you see your skin looking like red and hot and swollen and painful and so on. So this is from the effect of mast cells secreting histamine that dilate the vessels so more blood come and make it swelling, and heparin to prevent the blood from clotting so more blood can come. Now, I mentioned before that connective tissue is cells and matrix. The matrix is fluid, and this is what the fibroblasts make, and fibers. What kind of fibers? I have collagen fibers, I have elastic fibers, and I have reticular fibers. Give me example of collagen fibers. Collagen fibers are thick, the name coming from the type of protein. Collagen fiber, what type of protein? Collagen. How about elastic fibers? What kind of fibers? Elastin. How about the reticular fibers? What type of fibers? Reticular fibers, which is branching collagen. Reticular means branching collagen. This is number one. Number two, where? Where is it located? Collagen is located in ligament and tendon. What is the ligament and what is the tendon? Ligament is the connective tissue that's connecting two bones, to two or more bones to each other. Like if you ask yourself, what's keeping my two bones here together? Ligaments. What's keeping this bone of the forearm with this bone of my hand? Ligament, connecting them. Elbow, what's connecting the bones? Ligament. So ligament is connective tissue that's connecting bone to bone for stabilization. This is the collagen. And also tendon. What's the tendon? The tendon is the attachment of muscle to bone. So ligament is bone to bone. Tendon is muscle to bone. Look at this muscle right here. This is biceps. If you follow your biceps until the end, you will see something here connecting it to the bone. This, what I'm holding right now, this is your tendon. So go down with your biceps until the end. You will see something here that's tough, and tough because it's collagen. Collagen is thick, tough, thick and tough fibers. The next one is elastin, and elastin is not that thick and it's not that tough. So it can something that can stretch. It's serving the function. Respiratory passageways, you can dilate and constrict. When you dilate, it goes back. So this is located there. Vocal cords, if you're talking, you can extend and then relax. So you need something that can help you. You don't need something that's tough and that cannot expand. Tough and expand, this is collagen. Elastic, like a rubber band, this is elastic fibers. Where? Vocal cord and respiratory airways. Reticular fiber, this is a branching collagen. It's very delicate. So if you're going to ask yourself, collagen, you said collagen is thick and tough. No, collagen is tough as a protein. It's thick in collagen fiber. Reticular fibers is type of collagen that's very tiny and thin. And this is found in the spleen and liver in between the different parts. This is a summary of what we talked about. Clinical application, these are abnormalities that can happen to the cartilage, like chondrodysplasia, Marfan syndrome. This is an issue with the connective tissue. I repeat it several times. These abnormalities is for you to understand that something abnormal can happen, like to the bone, to the cartilage, and so on. Connective tissue can be different types. It can be areolar. Depending on the location and the function, it can be adipose. And adipose means fat. It can be reticular. This is depending on what type of connective tissue is it. It can be loose and it can be dense. If it is loose, it can be areolar, adipose, reticular. If it is dense, means it's tough. It can be dense, regular, dense, irregular, and elastic. And some of these are specialized, like cartilage, bone, and blood. Areolar connective tissue, most importantly, you can know where it is. Where is it located? This is located in the subcutaneous layer. This is the most important. It's a thin, delicate membrane in the subcutaneous. You can read the rest, but I'm focusing more on the most important. For adipose tissue, this is the adipose. Adipose means, adipo means fat. So adipose tissue, this is the fat, the tissues that store fats. Like the fat under your skin is adipose tissue, for example. And there is something unique about these fat cells because it contain a lot of fat. So if you remember from the structure of the cells, they have a nucleus close to the center, but because it stores a big amount of fat, the fat is going to push on the nucleus to the sides, giving it this unique appearance. You cannot see the nucleus like pushed to the side like this, except in adipose tissue. Adipose tissue, which is the fat is the most common one that we all know, is you say like, I'm gaining weight. It's the fat under your skin. This is a major one, but this is not the only one. Around all organs, you have fat to protect and absorb shock. Reticular connective tissue like liver and spleen, dense regular connective tissue, it have a poor blood supply, and most importantly, you need to know where. It's dense regular. What do you mean by dense regular? It's dense, it's tough and thick. Regular means, if you look at this picture, you see these lines are going parallel. Regular, it looks regular, it looks nice, parallel. Unlike the irregular, look at this. This is also dense, but irregular. Look how, if you try to track, you will not, these layers, it's not parallel, it's not in a regular shape. You can't say like, these are parallel lines, or you cannot say these are parallel curved lines. You cannot say anything. It's just haphazard. It's something that's irregular. So where is the dense regular located? It's located in tendon, ligament, and derms. Derms is under the epidermis. We will talk about this. The epidermis is this superficial layer of the skin. Underneath is connective tissue that's called dense regular. Dense irregular is in the skin, but it's also around the skeletal muscles. Skeletal muscles are the muscles attached to the skeleton. Elastic connective tissue, this contains a lot of elastic fibers. And this is an attachment between like something like the bones of the spinal column, like the vertebral column. It's in the heart, around the arteries, the big arteries, around the whole organs in general. So you do need to know at least the location of each one of those. The next type of connective tissue is cartilage. How do I know that cartilage is connective tissue? I told you. Is it epithelial cells? No. Is it muscle? Does it contract? No. Is it nervous system? No. It has to be connective tissue. So cartilage is this rigid, but it's not as tough as the bone, of course. So it is a rigid type of connective tissue, and it is for protection. And the matrix here is gel-like, like cartilage. Like if you look at this bone right here, this is your humerus bone, the bone of the arm, and this is bone of the forearm. The point where they make a joint between each other, there is a cartilage on the surface to prevent friction. So cartilage is for protection and to prevent friction, depending on the location. The cells of the cartilage are called chondrocytes. Use the same rule. What's chondro and what's cyte? Cyte means cells. Chondro means cartilage. Yes, you need to know that. You need to know chondrocytes. Chondro means cartilage. And it's located in lacunae, and lacunae means chambers or space. It's also most of it is avascular. So here's another one that's avascular. I mentioned the epithelial cells, like the squamous epithelium on the surface of the skin. It does not have blood vessels. The same thing for the cartilage. And there are three types of cartilage: hyaline, elastic, and fibrocartilage. Hyaline cartilage is the most common one, and the collagen fibers here are fine, and this is located at the end of the bone, and this is where the joints are located. Okay, this is one thing. The other thing is, this is the embryonic skeleton. What do you mean? Here's what I mean, and it's coming. Right now, as an adult, you have a lot of bone. Before you have this bone, when you were embryo, this bone used to be, most of it, not all of it, most of it used to be cartilage. It started as cartilage. That's why the embryo can bend freely. It's very easy. It used to be a cartilage. And then as you grow and change from embryo to fetus, you start to deposit some calcium, so changing this cartilage into bone. So I can ask you, what kind of cartilage that you can change into bone? Hyaline cartilage. What else do you need to know about the cartilage, the hyaline cartilage? It's at the end of the bone, at the end of the bone in the joint, also located in the nose, like this cartilage right here. This is the hyaline cartilage. Location is extremely important. And here you also need to know that this used to be your embryonic skeleton. What you see now as bone used to be cartilage. Okay, yes, like your humerus, the arm bone used to be cartilage. And as you grow, you put calcium and different types of deposition, and you change it into bone later on. The next type is called elastic cartilage, and location is important. External ear. So this is obviously very elastic. If you try to move your ears, you can easily move it because it is elastic, and you can actually stretch it and it go back. So this is elastic cartilage. The next one is fibrocartilage. This fibrocartilage contains a lot of fibrous tissue and a lot of collagen. So this is a strong one. And this is the example here, or the location here, is the intervertebral disc. Remember, if you look at the vertebrae before, your vertebral column in the back, you have a vertebra, which is one bone, and then you have another vertebra and another vertebra, and there are cartilaginous discs in between. I think we're all familiar with people saying, like, I have a disc, like a herniated disc or a disc prolapse. I think we all heard about this, right? Are we still following?
Yes.
Yes.
Yep,
Okay.
still here.
Did you hear about, oh my God, I was carrying something that's very heavy and I got a disc prolapse or herniated disc? Have you heard about this? This is a disc in between the vertebrae, and it is a fibrocartilage, and you need to know the type. It's also this pads in the knee and the pelvic girdle. All of this is fibrocartilage. Location is very important. The next type is bone. The bone is the most rigid connective tissue. Was the cartilage rigid? Yes, but the bone is even more rigid, more solid, and more tough. What's the difference between cartilage and bone? Most importantly, it contains more collagen, and the most important of all, calcium salt. Do you mean calcium? No, calcium salt. It's calcium plus something. Calcium carbonate, calcium phosphate. I hope you guys are studying as we go. If you're already studying, you should remember what salt mean, which is two molecules or two atoms. One of them is negative and the other one is positive. Calcium phosphate, calcium carbonate, whatever it is. And the bone have a lot of functions. These functions, if you ask yourself, why do I have a bone? To keep your body shape? Yes. To protect vital organs, like why do I have a skull? To protect my brain inside. Why do I have a chest cage that's bone? Why do I have the ribs? To protect the ribs, the lung inside. So protection, to support you, to store extra calcium. If you eat a lot of calcium, it will be automatically stored in the bone. It provides attachment to the muscles, like this muscle right here is attached to this bone. Okay, so the muscle is attached to the bone in order to move the bone using the muscles. So movement is another thing. It contains the bone marrow inside, and the bone marrow is for protection, for producing the blood. So this is another function. There are different types of muscle cells that you will need to know. One of them is osteocyte, and this is the mature bone cells and located in lacunae, which means cavities, just like the cartilage cells. Okay, so you have to know the different types of bone cells. This is the osteocyte, and let me give you another rule here. And again, the rules, when I give you a rule, I'm not giving you a rule for one thing. I give you a rule that you can apply so many times in the future, now and later on. What is that rule? Here it is. I mentioned before that any word can be splitted, most of the words can be splitted into two or more components. Here we can split it into two parts, osteo, and osteo is the prefix that means bone. How about site? I mentioned that site means cells, but this is not um, very specific or not very accurate. It means actually mature cells, not just cells, mature cells, because blast also means cells, but immature cells. So you have to understand the difference between a suffix site and a suffix blast. Both of them mean cell. What's the difference? Blast is an immature cell. Site is mature cell. And here is another rule, additional rule, add to this. Any immature cell is responsible for secreting something. Any mature cell, which is the site, is to maintain. Can I apply that on everything? Yes, blindly. Take it as a rule, apply, it always work. Okay, blast versus site. So here I have osteocytes. You will see the osteoblast coming. If I ask you the function, automatically, even if you didn't memorize, you're saying osteocyte. Site is mature, is to maintain the fluid. Does it make it? No, it maintain. Like make sure that the structure and the composition stay the same. Maintain only. Who is secreting in the first place? Blast. How about chondrocyte and chondroblast? Fibrocyte and fibroblast? Yes, you name it. Anytime you see blast or site, you can apply the rules. The other thing is the bone, which is the osseous tissue. Osseous means bone. Can be compact, and compact means tough and flat, like the outer, if you saw the bone before, any type of bone from outside, these big bones, the outside of the bone that's flat and tough is called compact bone. If you remove this compact bone somehow, if you peel it off and look inside, inside is more of spongy. Spongy means looks like a sponge, like have a lot of cavities. I think you know what the sponge looks like. So the compact bone is the outer layer usually, and it contains the building unit is called the osteum. When you follow with me, I'm not going to go that deep, but what I'm telling you, you have to know. These are the basics. What's the compact bone? The outer tough bone, outside of the bone. This is one. What else? The building unit is called osteum. And this osteum looks like this. It's, you know, when you get an onion and you cut it into two pieces, you will see this circle after circle after circle. We call that the circumvallate, or this circular appearance, circle, outside circle, outside circle, outside circle. This is how the osteum looks like. So if I want you to come with something with the compact bone, it is the outer tough bone that looks compact, means it doesn't have cavities. This is one. Osteum is the building unit. This is two. When you come to the spongy bone, it looks spongy, means it have cavities. What else? What's the building unit? Trabeculae. Trabeculae. Are you guys following with me? You have two types, compact and spongy.
Yes.
What's the bottom line? Compact. It's compact. What compact means? It means does not have cavities. Outside, compact. What else? Building unit is osteum. How about the spongy? The spongy looks like a sponge. It's more inside. And looks like a sponge means it has cavity. What's the building unit? Trabeculae. Extremely important. When I focus on something, these are the basics. You have to know. Blood is the next type of connective tissue. Apply the rules. I'm not going to repeat. Apply the rule. You will know that blood is connective tissue. And of course, we all know that the blood is for transport different materials, most importantly, oxygen, nutrients, and other things. And there are red blood cells, white blood cells, different types of cells and platelets. And this is summarizing the different types of cells. Next is the types of membranes. Membranes can be of different, and the membrane in general is a sheet of cells that make it's epithelial and connective tissue. Together we call it epithelial membrane, epithelial and connective tissue. And we are going to call these membranes depending on two things. Number one, what kind of secretion are you secreting? Number two, since you are a membrane like a sheet, you are a sheet. If you are a sheet, what are you covering or lining? So apply. What's the first type? Serous membrane. Why did you call it serous? Because it secretes serous secretion. What's a serous secretion? Watery secretion. The serous secretion is a watery secretion. This is where the name came from. Give me examples. Of course, you have to know this. Give me examples. The lining of the thorax and abdomen. Like this is your chest. This is your chest right here. The lung is inside. What is covering the lung and what's lining this chest cage? Serous membrane. Why did you call it serous membrane? It secretes serous secretion. What's a serous secretion? Watery fluids. So you have to know what does it secrete and where. The lining of the thorax, the lining of the abdomen. The lining of the thorax is called pleura. The lining of the abdomen is called peritoneum. Next type is called mucus. Why did you call it mucus? Because it secretes mucus. What's a mucus? Mucus is more viscous and thicker type of secretion, unlike the serous, which was watery. Give me examples. Lining of the digestive system, respiratory system, urinary system, reproductive system. You secrete mucus in any one of those. And the other thing is, that's also very important. Serous membrane secrete serous secretions. Where? In the cavities. But mucous membrane is also secrete mucus secretion in the cavities. Yes, but the serous secretion is lining the cavity that's not open to the outside. Not open. Like you don't have an opening between inside of your thorax and outside. If that's the case, your lung will collapse. You do not have an opening. Okay. How about the surrounding of the abdomen? Do you have any opening to the outside, like to the atmospheric air? Do you have an opening in your abdomen or something? Of course not. So this is another rule that's very important. Serous membranes line or cover cavities that is not open to the outside. Now, how about this cavity, my oral cavity? Isn't that open to the outside? It is open to the outside. So the membrane that's inside here is called mucous membrane. And the reason why, just for your knowledge, you don't have to know, but I'm just giving you additional information here. What's the reason for serous membrane secreting serous secretion and mucous membrane secreting mucus secretion? Serous membrane is watery secretion because it helps smoothing the friction between two layers. So it can easily slide, watery secretion. While the mucous membrane, in this case, like in my mouth, the oral cavity, my trachea, my esophagus, you have to secrete mucus because the mucus being thick, if something gets in like a dust or something, it will stick itself and you can spit it out. So this is the nature, it's serving the function. But you need to remember that serous membrane is covering and lining without communication to the outside. Mucous membrane is covering or lining a cavity that have communication to the outside. Reproductive system have a communication to the outside through the penis and through the vagina. The urinary system, same thing, but through the urethra. Respiratory system through your nose, through your mouth. Digestive system through your mouth and through your anus, and so on. So it automatically goes mucous membrane, you have an opening to the outside. The next type of membrane is cutaneous membrane, and by cutaneous membrane we mean the skin. Cutaneous membrane, the skin. And the skin is part of the integumentary system. Integumentary is coming from integument, and integument means the coverage. It's coming. Synovial membrane. Synovial membrane is a special type of membrane that's surrounding the joints. It's lining the joints from inside. If you look, like if this is the end of one bone and this is the end of the other bone, and they are making a joint like this, there will be cartilage here and cartilage here. And then it will be lined by something like this, a synovial membrane. The big joints are called the synovial joints. Muscles is the next type of tissues, and we have three different types of muscles: skeletal, cardiac, and smooth muscles. Skeletal muscles are these muscles attached to the skeleton. Cardiac muscles, actually, let me give you an exception here. The name comes from attached to the skeleton, but there are some exceptions of these skeletal muscles that are not attached to the skeleton, but we still call it skeletal muscles. When they give a name, they remember that this is all ancient Greek and Latin names. So when they discovered these muscles, it was all attached to the skeleton, and then they found the same muscles located in other spots, not attached. It's just an exception, and not attached to the skeleton. It's not 100%. Like the external anal sphincter. This is, of course, not attached to any muscle, any skeleton. Still a skeletal. Why? Because it consists of skeletal muscle tissues that we will talk about. It fulfilled the same criteria, but it just happened that it's not attached to the skeleton. So 99% of the time, skeletal muscles are attached to the skeleton, with just this exception. How about the cardiac muscles? Cardiac muscles are within the heart. Smooth muscles, do you remember when I mentioned about the connective tissue that you get it by exclusion? It's not epithelial, it's not muscle, it's not nervous, it has to be connective tissue. Apply the same rule here. You name it, you don't have to memorize. If I ask you, what is the smooth muscle, like where? Don't memorize. Just ask yourself, is it skeletal, attached to the skeleton? No. Is it in the heart? No. That's it. You name it. Smooth muscles. What is the muscles within the stomach? Smooth muscles. Intestine, smooth muscles. How about the blood? Smooth muscle. How about the blood vessel? Is it attached to the skeleton? No. Is it inside the heart? No. Smooth muscles. You name it. Anything. Urethra, ureter, bladder, reproductive, anything. You don't have to memorize. Just use your brain and ask yourself, is it skeletal? No. Is it inside the heart? No. Smooth. Okay, is this point clear enough? It will help you a lot. You don't have to memorize. Just apply the rules. What are the criteria about the skeletal muscles? Number one, from the name, it's attached to the bone with that exception that I mentioned. Number two, striated. Striated means it has layers like this, parallel layers. Striated have parallel layers. Voluntary means you control it. You can tell your skeletal muscles like this. I want to contract my biceps here. I want to relax my biceps here. You give order to the muscles, say it, so it is voluntary. You can control it. And this is the only one that's voluntary. Okay? It's long muscle, cylindrical muscle. It's voluntary, striated, attached to the bone with the exception of the external anal sphincter. It is skeletal muscle. Like if you take a biopsy or if you take part of the external anal sphincter and look at it, it looks like this. So you have to call it skeletal muscles. It is not attached to the bone. Yes, take it just as an exception. Other than attaching to the bone, it follows and it fulfills all the criteria. It is striated, it is voluntary, it's multinucleated cells, it's cylindrical cells, it's long cells, it's innervated by nerves, all criteria, it's fulfilled. With that exception, we still put it under skeletal muscles. The next muscle, let me take the cardiac muscles first. The cardiac muscles are also striated, but it's not just parallel, it's actually branching. Like you go like parallel like this and give a branch. Parallel branch. Look at this. This is parallel to this. But do you see how it's giving branches? So it's branching. Only in the wall of the heart. It's involuntary. Can you order your heart to stop? Like stop your heart. Can you? Of course not. It's involuntary. Still striated, and it has something unique that's called the intercalated disc. Intercalated disc. The intercalated disc are these discs right here, so that the heart act or contract, all of the heart contract, all of the heart relax. What help it is the intercalated discs. You need to memorize these cells. I think voluntary and involuntary is the easiest one, because just ask yourself, can I control it or not? The last one is smooth muscles, and smooth muscles, again, do not memorize. If it's not in the heart, if it's not attached to the skeleton, with that one exception, you name it. And this one, it's smooth muscles. This one is not striated. It looks like a spindle shape, and it's all over the place. And it is involuntary. Can you contract your intestine right now? Can you contract your urethra? Of course not. Can you contract your bladder voluntarily? Like, can you relax? Can you contract? You cannot control it. It works automatically. You can reinforce, yes, but you cannot start. Like, show me how you contract your intestine right now. Contract your intestine. You can't. So it's involuntary. Last tissue here is the nervous tissue, and the cells of the nervous tissue are called neurons. Neurons. And this is found in the brain and spinal cord. Together is called the central nervous system, which is nervous system at the center. And there are peripheral nervous system, these wires that go from the central nervous system to outside. Beside the neurons, which are the actual nerve cells, the actual nerve cells are called neurons. There are other cells that are called neuroglia. Neuroglia are cells in the nervous system, but it's not part of the nervous system. It's just supportive cells, supportive. As usual, the rule is, from science to technology, clinical application, you're not asked about it, take a look at it. It can help you understand. That's it. They are talking about the tissue engineering. They can take a progenitor cells, like if I have an issue with the bladder, right now they can take part of the bladder and the progenitor cells, we talked about it before, that come from the stem cells. I think we talked about it last week. But progenitor cells come from the stem cells. You can take it out, they put it in the lab, they feed it, and it will grow. You can do the same thing for the skin, for example. They take a little piece of your skin, they take it in the lab, they put nutrients on it, they put growth factors on it, and it will become a big sheet of skin, and they can patch it. It's very expensive, so they usually keep it to something that's very obvious, like your face. If you have a scar in your face, it doesn't look good, so they can actually do that. You take a little piece from here, and they multiply it, they do it, and then they patch it. So this is a clinical application. And here is a comparison between these different types of tissues, and you can take a look at it. So that's it for this chapter. And we are going to do the next chapter, which is chapter 6. Okay, chapter 6 is a smaller chapter. I will try to finish it. Obviously, I will not be able to I'll not be able to do 7, of course, but I will try to do this chapter as much as possible. Share screen. Okay, now it's working. At any time, if you see the sound is muted or you can't see what I'm talking about, please let me know before I move on for a couple of minutes, and then it will be late. So this chapter 6 is about the integumentary system. We talked a little bit about integument, and integument means the cover, the covering system. And the integumentary system is a covering system, which is the skin and the skin appendages, or the skin tissues. Like, if you ask yourself, this is my skin, what's appendages to the skin? The hair is appended to the skin. The nails appended to the skin. Sweat glands open to the skin. So we call those the skin appendages. And or the accessory structures like hair, nail, glands, and sensory receptors. We call all of that together integumentary system. And there are different cell tissue types, or types of tissues, epithelial and connective tissue together, making that system. The skin is made of, or the cutaneous tissue. Cutaneous is the same as skin. Remember this. Skin is also known as cutaneous membrane. It's two layers on top of each other, the epidermis and dermis. Derms is the inner one. Epi is a prefix that means on top of, superficial to, on top of something or superficial to something. So derms and the epidermis on top of the derms. So if I'm touching this, my skin from outside, this is the epidermis. Where is the dermis? You don't see it, it's underneath. The epidermis is the outermost, and it consists of stratified squamous epithelium. Yes, you need to remember this. You have to remember this. This is the outer layer, and it is stratified squamous epithelium. I mentioned that before when I told you you need to know where these tissues are located, and I'm repeating again. The epidermis, since it's part of the skin, it is stratified squamous epithelium. Underneath the epidermis, you have the dermis. And the dermis is thicker, and it consists of connective tissue. This is what you have to remember. It contains collagenous, which is collagen, and elastic fibers. But the most important is which one is thicker, epidermis or the dermis? The dermis is thicker. What does it consist of? Epidermis, stratified squamous, dermis is connective tissue. And then you have underneath the whole skin. So this does not count as a skin layer. It does not. Subcutaneous layer. Remember, cutaneous is skin. Sub means like submarine, under the water. Subcutaneous, under the tissue. Under the skin. So subcutaneous layer is the layer under the cutaneous, which is under the skin. Hypodermis is, hypo means under or lower. Dermis is the inner layer of the skin. So it's serving the same meaning. What's the difference between subcutaneous and hypodermis? No difference. Just think about it. Makes sense. So it's under the dermis. Is that a layer of the skin? No, it is not. But because it's under the skin, so we're just studying this as a layer under the skin. It's not part of the skin. So why do you have this layer under the skin? This is the layer that contains the adipose tissue. Like I'm gaining weight. Where is it collecting? Subcutaneous tissue, subcutaneous layer under the skin. You keep your extra fat under the skin. So it's mainly adipose tissue. And it contains blood vessels and nerve supply that's going to feed the layer on top of it, the dermis, and the dermis itself is going to feed the epidermis. Remember, the epidermis is avascular. Stratified squamous epithelium is avascular. A is a prefix that means no. A, an, on, m, any one of those. So look at this. This top part right here is the epidermis, and look at this really thick one, the dermis. And if you look at the dermis, look at this here. This is a section of the skin, and it contains, this is the epidermis on top here. And if you look at the dermis, this is the one that contains all these glands. Whether we're talking about the sebaceous glands, whether we're talking about the sweat glands, these are the sweat glands, these are the different types of glands. And even though the blood vessels are located in the subcutaneous layer or the hypodermis, it gives branches to go to the dermis. Does the branches go to the epidermis? Of course not. Again, the epidermis is avascular, no blood vessels. So the blood vessels are located in the subcutaneous or hypodermis, and it gives branches that goes to the dermis. It does not give branches to the epidermis. How the epidermis getting the nutrients and the oxygen? By diffusion, just diffuse up. Okay. The epidermis is stratified squamous epithelium. There are multiple layers. The basal layer is called stratum basal. Basal means base. This is the lowermost part. And it is important, and the top layer is called the stratum corneum. So stratum basal is the base, stratum corneum is top. Corneum is coming from corneo, and corneo means tough. Why is it tough? Because it contains keratin. What's the keratin? Keratin is a tough fibrous protein that fills these different layers of the stratified squamous epithelium, specifically the top ones, in order to make it tough. so that you can bear the friction and the protection that is that the skin is supposed to do. Your skin is not all the same. The skin of the palm and sole contain an extra layer. So it's thicker in the palm and sole. This is thicker than the rest of the skin. The rest is missing one of the layers. So these are the layers. The basic layer, which is the stratum basal or germinativum. And in this one, you need to know the function. Stratum germinativum or stratum basal. Everything makes sense. Stratum means layer. Basal means at the base, at the bottom. Germinativum is come from germinate. So this is the one that's going to germinate anything else. Any other layer on top, if it died for some reason, or if you just replace it on a regular basis, this is where it's going to germinate. The basal layer germinates. And that's why if you lost your skin, they give it degrees. Like if you have a burn, they say first degree, second degree, third degree, right? If it is first degree means this skin is lost, you still have the germinativum. It's going to replace it. Don't worry about it. But if you lost the germinativum, it's over because nothing is going to germinate. So it goes germinatum, spinosum, granulosum, lucidum, and corneum. This lucidum is the one that's missing in the thin skin. What's the thin skin? All the skin, minus palm and sole. Palm, thick skin, it contains 5 layers. The rest of the skin all over, it is the thin skin that contains only 4 layers. Which one is missing? Lucidum. What's lucidum means? Lucid means transparent. It's actually transparent. They look at it and they found it transparent. If you wanted to know the rest, cornea means corneo, which means tough. Granulosum is coming from granules because it's contain granules. Spinosum because it's dry and looks like spiny shaped. This is where the name came from. And these are the different layers. Something important, another thing that's important about the basal or the germinativum, you need to remember both names because it germinates. This is where the name came from. It germinates the other 4 layers or 3, depending on thin and or thick skin, and it's also at the base. What else is important about the germinativum? This is the one that contain melanocytes. Melanocytes. Melano means melanin, which is this dark brown, black pigment that give the skin its color. Cytes means mature cells. Mature cells. So melanocytes are the mature cells that make melanin. Where is it located? At the stratum basal or stratum germinativum. And this is the one that make melanin. And then when you make melanin, melanin is going to squeeze itself and goes up in the next layer. It goes layer after layer after layer after layer until it goes to all these layers, giving the skin its color. And let me give you this very important piece of information. The color of the skin does not count on the number of these cells. It counts on the activity of these cells. So it's not about the melanocyte, it's about the melanin itself. Meaning, I might have more melanocytes than you, but you are lighter color than me. Why? Because I have less melanocytes, but my melanocytes are very active, producing more melanin. So I'll be darker than you. Did you get the idea? It is not about the number of melanocytes, it's about the number of melanin. The skin color come from the melanin, this is 1. The keratin, which is vitamin A. So the melanin will give it that dark brown, blackish, it's more brown, dark brown. The keratin will give it that tinge of orange color. And also the oxygenation of the blood will give it another pinkish, reddish tinge. So it's not just melanin. Melanin is the main one. The more melanin, not melanocyte. The more melanin you have, the darker you are. But your skin color is a mix the brown, dark brown of melanin, together with the orange yellow of the keratin, together with the red pinkish of the oxygenated blood. Put all of that together, it will give you your skin color. You might be light colored skin, and another person is light colored and more pinkish than you. Why? It's more oxygenated blood. Some people are a little bit like their color is a little bit yellowish colored. They have more keratin, and keratin is coming from carrot. Remember, the carrot is orange. If I said keratin, I'm sorry, I take it back. I mean keratin, which is coming from carrot. That's orange yellow color. And there are a lot of factors that are controlling the skin color, including hereditary factors, environmental factors like how much you're exposed, and that's like if you're exposed too much to the sun, if you're taking like sun bath or suntan or something like that, it will become active. You know what happened when you have this tanning? What happened is they expose you to these rays or radiation of rays, the actual rays that activate your melanocytes. So this is how you get it. Beside oxygenation, vasodilation, the keratin, and so on. There are some abnormalities. Sometimes you have an area that have more melanin than it should. It will give you that patch that's dark. And sometimes you have patches of white. And this basically means like your skin is dark, but you have patches of white. Or sometimes there are some people that are completely white. Not white meaning light colored. No, I mean white. Zero melanin. We call that albinos. And these have genes that make them defective of melanocytes. Their melanocytes is not working at all, not less. No, it's not working. And this would be albino. And this is for the skin color. Tumors or cancer can come from these melanocytes, like melanoma, which is a skin cancer. The derms is the next one, and this one contain muscle fibers, contain branches of the blood vessels, but this is definitely the location of the hair follicle, and the follicle is the roots. The roots is located inside this follicle. Sweat gland and sebaceous glands are also located there. Sweat glands, it's what secrete the sweat itself, which is this salty, watery secretion. Sebaceous gland, I mentioned it before, the glands are named after the secretions. Sebaceous glands secrete sebum. What's a sebum? This is the oily secretion that make your hair a little bit oily, a little bit soft, and so on. Also contain the sensory receptors. The derms consist of two layers that fit into each other. If you can see my fingers, it fits exactly like this. There is a papillary layer, which is this, superficial, and reticular layer, which is deep. The two layers fits in together in order for the derms not to move. Okay, the papillary layer, those two fits together. The epidermis can move a little bit, but the two layers cannot fit in with each other. This is also going to make, together with the epidermis, this is going to make the fingerprint. Accessory structures, hair follicles, nails, and glands. Nail consists of three parts. The nail plate, which is this big part right here, and the nail plate, and the nail bed, which is this part right here, and the lunula, I'm sorry, this is the lunula right here, which is the most active growing part, which is half lunar shaped, which is this part. I don't know if you can see this or not. It's this part right here. So this is the nail plate. This is the free edge, and the cuticle is not really part of the skin of the nail. But if you have this that's growing, this skin growing, you can push it back. This is called the cuticle. Hair follicle is this follicle right here, and the sebaceous gland open directly into the shaft as the hair is growing. It contains the root, it contains the bulb, and the bulb is the dividing cells, and contain the shaft, and the shaft consists of dead epidermal cells, which is the same cells as the epidermis. The hair is the same origin as the epidermal cells, but it's dead. And it contains a lot of keratin as well. and this is located in the derms. Um, Alopecia is when your hair follicles are not active anymore, so you start to lose your hair. This can happen with age, but some people can have antibodies against the hair follicles, autoimmune reaction, which is called alopecia areata. It's a clinical application, not the most important. Sebaceous glands are the glands that secrete the sebum. Again, take it as a rule. Any gland is named after the secretion. Sebaceous gland is a holocrine gland. Do you remember holo? What holo means? Are you following? What's holo?
Whole.
Whole, exactly. So these sebaceous glands, when they secrete the sebum, they are going to die. And then it's going to replace, it's going to recycle. But the whole thing, apo is like this. You're losing this part only, apocrine. Merocrine, you don't lose anything, just by exocytosis. I mentioned that before, but it's just repeating here. So if you ask yourself, what is this sebum? The sebum is an oily secretion that make our hair more soft and smooth. And of course, since you don't have hair and the sebaceous gland open to the shaft of the hair, so obviously I don't have sebaceous secretions or sebaceous glands in the palm and sole. Some people can have disorders of the sebaceous gland, and this is called the acne vulgaris. I think we're all familiar with the acne, these especially in teenage, because the hormones are very active at that time, and they activate the sebaceous glands too much. And then some of these sebaceous glands are closed, blocked. So it's still secreting, but the secretions stay inside until it starts to bulge out. This is where you see these whitish acne vulgaris. I think we're all familiar with the acne that come during the teenage. So this is extra sebum that's going to accumulate, and it's clogged, it stay inside, and it can leave with either treatment or it can open later on. Glands are sweat glands, and sweat glands, we talked about those before. It's open to the epidermis. It's the actual glands. All the glands are in the dermis, by the way, all glands, but they open to the dermis somehow. Except the sebaceous gland is not really opening. It's open to the hair, and the hair take the secretion as it go out. So sweat glands, it originates in the deep dermis, sometimes in the hypodermis. Ecrine or merocrine, mero. These are the sweat glands that does not lose part of it. And these are the glands are responsible for regulation body temperature. Like if it's getting hot, you get more sweat. Apocrine sweat glands. Apocrine sweat glands are modified sweat glands that does not secrete the regular sweat that you know. It's a gland that secretes the top part, hence the name apo. And they secrete a special type of secretion, not really sweat. They secrete secretions after puberty, because these secretions are related to sexual attraction. That's why it's located like around the genitalia and the armpit, around the nipple, and so in certain locations. And these secretions, when they are secreted to the surface, they break down and make an odor. Physiologically, it's for sexual attraction. This is the apocrine, and it's important to remember that it secretes with exocytosis, but you lose top part. Ceraminous gland, again, the name comes from the secretion. It secretes ceramin, which is the airwax. Mammary gland, this is the gland that secretes milk. The mammary gland is obviously the breast during the active period, which is during pregnancy and lactation. This is a summary of all what we talked about. The skin is responsible for different functions. Protection is one thing, obviously, but it also prevents the water loss. That's why if you have any scratch or something, you're oozing out. And this is you're losing water, so it maintains your water. Receptors, if you touch something, the skin have receptors. You secrete some waste products, believe it or not, within that sweat glands. Sometimes you can secrete something like uric acid, believe it or not. You can secrete salt, and sometimes you see people having their skin is sweating a lot, and the skin is literally become like whitish a little bit. This means that they are eating a lot of salt that the urine cannot get rid of. So they start to secrete it within the sweat secretion. So obviously it's for extra waste products. The skin also make the vitamin D when you expose to sunlight, ultraviolet radiation, because it activates the skin. Regulation is regulating body temperature, and this is very important part to know. Regulating body temperature. How do you regulate your body temperature? Number one, I mentioned that in homeostasis before, so it's kind of repeat here. So regulating body temperature, how the skin regulates body temperature. Number one, sweat. When it's too hot, you sweat too much. So you're losing the sweat, which is watery, and it's coming from inside, so it's taking the core heat from inside to the outside, and then you lose it out. This is one way. The other way is the heat inside you, it can actually go to the surface with some fluids and evaporate. Do you mean the sweat? No, I'm not talking about the sweat. The sweat, it comes from an actual exocrine gland. It go to the duct to the outside. This is something else. Some fluids ooze itself in between the cells until they go to the surface, and then they evaporate. This is another one. The third one is the blood vessels in your skin. If it is too hot, the blood vessels dilate so that more blood come from the core, carrying the more warmer heat, or the heat from inside go to the surface, and you lose it out. And vice versa. If it is getting cold, you reduce the sweat. You don't sweat that much. You reduce the evaporation, and also you constrict your blood vessels so that you keep your warm core blood to yourself. You don't expose it out, because when you dilate and expose it out, you lose the heat. If you constrict and you keep it in, you're keeping your core body temperature. You lose the heat by radiation, and this is the primary way. Conduction, I mentioned that before, that it moves up. Convection, when it is circulating in the air, and evaporation is like when you sweat, or evaporating from, I'm sorry, when you sweat and then it evaporates, and also which become a gas. I talked about this before in homeostasis, so I'm not going to spend much time here. If it is getting colder, obviously you need to increase the heat, or the thermal receptors in the hypothalamus, and you're going to react. If it's getting cold, you turn on the heating unit in the air condition. Apply that here. Your heating unit is your muscles contracting, your skin blood vessels constricting, you're not sweating that much. So all of that will keep your body temperature, so that, because it's cold outside. If it is hot outside, your thermal receptors in the hypothalamus are going to change that. It's going to turn on the cooling unit, or the air condition, and that, if that's the case, you're going to vasodilate, you're going to sweat more, and so on. And muscles, of course, it's not going to contract. If you if you cannot control your body temperature, so your body temperature is not like, if I measure it right now, it's not exactly 98.6. It goes like floating like this. It vibrates. It goes like up and down, like zigzag like this, like 78.6, 78.7, 0.5, 0.6, 0.7. It always fluctuate like this. And that's okay. That's normal. If I measure your body temperature and I see it 98.8, 0.9, that's okay. But if you exceeded that, this is not normal now. You call it hyperthermia. Hyper means too much. Thermia means heat. So if your body temperature, if you tried like to sweat, if you're trying to dilate and you're doing all of that, but it's not helping you to get it back to normal that much, you go into hyperthermia, which is something like fever or something like that. The opposite is hypothermia. If you go down like under 98.5, for example, if it goes not in that fluctuation, which is within 0.2, if you go too much, 98.3, 98, something like that, this is called hypothermia. And there should be a treatment for that. So if you lost the ability of your homeostatic system, which is what we talked about, starting with the hypothalamus, you can get into fever, or you can get into, which is hyperthermia, or you can get into hypothermia. If you go into hyperthermia, this have some good effects. Like if you're having, if you like you have infection and I'm getting fever, is that fever doing anything? Yes. If you ask yourself, why I'm getting fever when I get infection, is that something beneficial? It's actually beneficial. How? Because fever, number one, it suppresses the activity of most of the organisms. The organisms, or the infectious organisms, they love your body temperature. They love the normal body temperature. If it goes up in fever, it will be suppressed. This is one. The other thing is it activates your metabolism, so you have more energy. If you have a wound, what's going to happen to it? You start with inflammation. And if you look at inflammation in your hand, for example, it's always red, swollen, warm, and painful. And these are called the local signs of inflammation. If you have a cut, if you have an injury, it can be shallow, affecting the epidermis, and it can be deeper, go to the derms, and it can actually go all the way down. What happened here is you get bleeding a little bit, which is called the hematoma, and it will make a blood clot, and then this blood clot will start to have some platelets to block it first, and then you have some fibrin to form something called the scape. The scape is that dark brown, firm cover of your wound that you're not supposed to remove. It will stay until the underlying tissues replace itself, and then it will going to fall anyway. The fibroblast is going to help you with that. That's giving you the collagen fibers in order to regrow, and then the epithelium underneath is going to grow. If this scape is become too much or permanent, like you have a lot of collagen fibers, this is called scar. So here it is. If you have an injury, you have a wound, blood is going to cause a hematoma here. It's superficial, is in the epidermis. It can go deeper to the derms. And then collagen fibers are going to come. You have bleeding first, and then platelets are going to stop the bleeding first. And then macrophage is going to clean the area. Collagen fibers make granulation tissue to close this area. And then the epithelium underneath is going to regrow. You have a scape that's going to fall automatically. Next part is burn. The burn can be superficial, which is taking partial thickness, which is, we call it the first degree, or superficial or partial. And this is like if like hot water, but not that hot, come to your skin, it will go away. It looks like reddish a little bit, but there is no scar. Deep or partial thickness, which is the second degree, is deeper than that because it go a little bit to the derms, which is underneath. Like if this is, like if you have tea or something, if it is not that hot, it can give you like first degree. Sunburn, first degree. It's just epidermis, you have some inflammation, redness, that's it. For the second degree, you will start to have a deeper, which go to the epidermis, and you know the epidermis contain all these glands. It can actually burn these glands. But it usually recover completely without a scar. The full thickness is the one that's going to the derms, the epidermis. Derms plus the accessory structures. It can go to the hair follicles inside. It can go to the nail. It can go even underneath more than that. It can go like even to the muscles. And unfortunately, this one is the one that's going to cause permanent scar. And if that's the case, they might need skin grafts. Depending on how much, so this is, if you're talking about the thickness. If you're talking about the area, just give me a couple more minutes, I will finish this. If you are, like if you go to the hospital, if somebody having a burn and go to the hospital, they're going to evaluate in two different ways. The first thing is the thickness. Is the epidermis only part of the epidermis? Is it the whole epidermis and parts of the dermis? Or is it taking the dermis and accessory structures first, second, and third? It can actually be four, which is like muscles and bones. It can happen. The second evaluation is we need to know the area. Is it a small area to determine how much fluids are we going to give you, because if you have burn, you're losing a lot of fluids. I have to give you replacements immediately. So depending on, is it this patch only? Is it the whole forearm? Is it the whole upper limb? Is it the chest? And this will give us the rule of the nines. And follow me as we go. Your head is 9. I'm talking about adults. Your head is 9. Your upper limb, each one is 9. 9, 9, 9. Put 2 9s together, which is the 2 upper limb, it will make 1 lower limb, which is 18. The other lower limb is also 18. Together, that's 36. This is the trunk, which is this. So 9, 9, 9. 2 9s is 18, 18. If you put all of this together, that's going to be 99%. The 1% is for the genitalia. So, I mean, this question can be kind of hard, but just in case if you see it, it's telling you like, if you burn the whole front of your upper limb, how much is that? If the whole upper limb is 9, this is 4.5. This is how it goes. How about the whole front of the upper limb and whole front of the lower limb? Well, this is 9, so this is 4.5. The lower limb is 18, which is 9 plus 4.5, 13.5. This is your answer. So one more time, 9, 9, 9. 2 9s is one lower limb, 18. The other lower limb, 18. 2 18s, the trunk. This is the easy way to remember these numbers. Last thing here is the lifespan. Everything, just take it as a rule. Everything deteriorates with age. The skin with age become thinner, fragile, scaly, lighter colored, because everything deteriorates. This is basically what it is. If you just say that, will give you everything. Can you make vitamin D as much? No, deteriorate. Can you regulate your body temperature that much? No, regulate. Sensation, regulate. I mean, you lose it. Nails, impaired. Hair start to fail. Its hair become thinner. Melanocytes, less active. Sebaceous gland, less active. You start to get wrinkling and sagging of your skin and so on. So basically everything deteriorates. Whatever you learned about the function of the skin, you say deteriorate, you will get it with age. I think that's it for this chapter. So obviously next time I will try to do the chapter as fast as possible, and I will try to leave some time for the lab if possible. But right now, if you're doing the lab and you have some questions, write it down. And Thursday, this coming Thursday, if you are section 17, you're going to be from 4 to 5:30 this coming Thursday. If you're section 10, you're going to be from 6 to 7:30. It's an hour and a half. The basic thing that we have to, the lecture, remember the lecture will cover the lab anyway. So I have to do the lecture. I have to finish it. This is a lot more important because the lab depends on your understanding of the lecture. So I'll spend more time in that. But meanwhile, if you're doing the lab and you find some question, write it down and ask me at the end. Okay? Do you guys have any questions before we leave? If you're done, you can leave. If you have a question, stay. I'm staying a couple more minutes just to answer any questions. But
so there's questions in the chat about not being able to see the slides posted to Blackboard.
These slides this time, the unit 2.
You can't see chapter 5 or 6.
Oh, this is unit 2. Okay, let me just take a look at it. Just give me a minute. Let me just stop the sharing here and stop recording.